Welcome to the Therapist Thrival Guide. My name is Miranda. I'm a licensed clinical social worker, and I'm here with Shelby. Shelby, do you want to go ahead and introduce yourself?
Hi, yes. So I'm Shelby. I am here at the Ellie Mental Health St in St. Petersburg, Florida. I am a registered intern mental health counselor, but I am also a registered dance movement therapist, which is kind of interesting to be able to have both fields and bringing that to a table for people.
Yeah. So with a dance movement therapist, is that a specific degree that you went for, or is it like training that you got after you got your mental health degree or like your master's?
Yeah, so it's interesting. The school that I went to actually, you should have a psychology minor. And I did. I had everything. And the school that I went to was actually the title is clinical mental health counseling with specialization in dance movement therapy. And so the school is Lesley University up in Cambridge, Massachusetts, and their program is both the psychotherapy and the dance movement therapy happening at the same time at a master's level. And so it's a 2 or 3 year degree, depending on which one you want to do. And then as soon as you're done that degree, you're a registered dance movement therapist. There's no anything. You just put in your application, you put in your hours and everything. And it's just kind of, boop, then you start going, and then you do what you need to for your backup, of whether you're an LMFT or going for licensed mental health counseling or a licensed clinical social worker, whatever that is what you continue for your state obligations.
Interesting. Okay, so then which of those degrees are you, or which of those programs are you did you complete, or which licensure are you pursuing at this, a license track are you pursuing at this point?
So I have my license in dance movement therapy. So there's 2 fields in dance movement therapy. It's either a registered dance movement therapist or a board certified dance movement therapist. And of course, you have to be registered to move up to a board certified because you have to have experience. And then, of course, you can do everything as a registered dance movement therapist that a board certified person essentially does, which is the research. You can connect with people and get on the ground with that. You don't have to be a board certified dance movement therapist, but it's a good one to kind of have. But the track for that is very simple, very easy. I feel they're you do enough of the work within your program, you're going to continue to do the work and you're going to continue to learn. We're always connected. Sure. There's no disconnect. There's always conventions happening. There's always connections that's happening, and all these things that all of us are always connecting. And I'm always connected with my cohort too, with the people that I had with my degree for dance movement therapy. We all got really close. And so everybody's spread out. And everybody has different viewpoints too, and how to use this therapeutic approach for dance movement therapy.
This is so cool. And I appreciate you kind of walking me through that a little bit, because in my mind, it's similar to art therapy, where sure, you can infuse some of this in your practice. You could do, art skills in your therapy with clients, but you're not a registered art therapist when you, you have to actually go through that training. And so similarly, it seems like with dance movement, we could infuse some of this into, I'm a licensed clinical social worker. I could infuse some of this in with my clients, but I'm not a dance movement therapist. And so that's kind of the difference there, but that makes sense. Okay. So then how did you get started with this? This is amazing.
So it's a good, long, story. It has a lot of emotion and meat to it. So I started dancing when I was a freshman in high school and loved it. And I always wanted to do something with dance and helping people. And for the longest time, that was physical disabilities. I'm I'm going to help people with physical disabilities. I'm going to help them because I also have a physical disability. I'm hearing impaired. And so that was my motive. That was my drive. And for the thing that I was going to do for the longest time. And then 2015 hit, and I got the most devastating news that can happen, where I had gotten news that my boyfriend had passed away. And it was hard. I was having a hard time verbalizing what it was that I was feeling. I was so young too. And I was doing this project, a dance and technology project, and I had a different focus and I couldn't do it. And I asked my dance professor, I was like, can I please like change this to be able to help me process this grief that I'm dealing with? And she was like, yes, like, let's go ahead and go for it. And I went ahead and made this video that's a celebration of him and our story, but also takes you through each stage of grief. And when that happened, it was a click for me. I was like, there's a connection here physically and mentally, and I want to do something with that. Like, what is this? And I kept searching and searching and searching. And I went to my undergrad and found this like amazing, school with a mind body connection, which I was like, this still searching for something. And then randomly across like my Facebook page, dance movement therapy popped up, and I started researching it. And I was like, oh, this is it. This is my thing. This is what I'm supposed to do. And so I started researching schools and what I wanted, what I needed, what the programs were able to offer me. And from there, I just dove straight into dance movement therapy, mental health, and still want to help people with physical disabilities and still able to if I want. But the mental health aspect was such a click for me, and being able to use that to help people heal is so like fathoming and creative and sparks all of my interest as a therapist.
Thank you so much for sharing that. And I just think that's incredible that it's almost like you realized how helpful this was before you even, like you understood the connection. Your body recognized how it was able to process some of this loss through dance and through movement. And then now you're able to help clients do this. Like, I just, like, I have chills. That's so cool. So what exactly is dance movement therapy? Is it just dancing? What does this look like?
Typically when this word comes out, people are like, am I taking a dance class? I'm like, no,
I didn't even think
you're
of
not
that.
taking a dance class. They're like, I really can't kiss my face. I'm like, no. So dance movement therapy is, the basis of it has always been that movement is our first language. We don't come out of the womb talking. And when in the womb, movement is happening there. So like it is our first language. It is how we notify our wants, our needs, what's happening. And so it's off the basis of that. It is not, yeah, I'm going to do ballet. Yeah, I'm going to do like all of these crazy things. It is finding movement of that person, what feels natural to them, what feels good for them. When they are feeling angry, what is their movement? When they're feeling sad, what is their movement? How do they process this? How do we help them reprocess it? How do we help them reframe it as a therapist? Is where all of that comes into play. So it is using movement on a psychological level for social, cognitive, all of those, branches that we try to hit just in the psychotherapy world. It's just in a non-verbal way, but we also recognize the importance of verbalization as well, to be able to have that too. Because once it processes in the body, they can be like, oh, okay, now I can verbalize this a little better.
Sure. Interesting.
So then it can come out that way. So there's some dance movement therapists, and I like to do the practice too of like, let's move, let's talk. Let's move, let's talk. And then I have some people that are strict, like, hey, I don't want verbal. And I'm like, okay, you don't want verbal. Like, we're just going to do movement the whole entire section. And it's bringing in those dance movement therapy skills of how do I help them on this therapeutic level during those times.
I have so many questions. This is so cool. Okay, first off, what does your office look like? Like, do you have space to move in your office?
So in my office, I have space for like me and one other person.
Okay.
If it goes beyond one other person or that person's wanting more space, I will definitely move us over into our little group room that we have. So that way they have more space. I can also do dance movement therapy via telehealth. This does not have to be an in-person thing.
Oh, yeah.
So I just say if any of my clients do like have a virtual platform and they are interested in it, I'm like, I just want you to like have space where you don't feel constricted. Is the most important thing. And I also say dance movement therapy doesn't have to be done standing. It can be done sitting. It can be done laying down. It can be done in any way that is going to make the client feel comfortable, especially in the beginning. It's really vulnerable.
Yeah.
And being okay with that can be hard. And so I really let them kind of take that lead with some guidance. And then we work on that, kind of built up rapport and strength in terms of movement. So it's fun. It's interesting. I always do it at the client's comfort level.
Yeah. Because like, do most of your clients seek you out for dance movement therapy, or do you feel like a lot of your clients who do dance movement therapy have a background in dancing then too?
Not necessarily. So I have some clients that have reached out to me specifically just for dance movement therapy. And they're like, we want this. We want to have this as a holistic approach, because essentially that's kind of what dance movement therapy is considered, more of a holistic approach, even though we're applying psychotherapy skills in the session without people realizing it. So that portion is there. And then we move on to what that feels comfortable for them. So there are some people that see me for dance movement therapy. There's some people that see me for both. They're like, hey, I want dance movement therapy, but I also want talk therapy.
Sure.
And so we kind of do it based on, like, I always have the 2 plans in my head for those clients. If they're doing talk therapy that day and they just need to process something, like what that plan look like on just a therapist like level. And then if they're wanting to do dance movement therapy, what does this kind of ideal plan look like in terms of movement with them, to help them in that retrospect aspect. So that's kind of how that works, at least for me, and how I approach that. That anybody can reach out to me. And there's also some people that have reached out to me that are just kind of like, I want a body positive therapist.
Oh, interesting.
But they're like, but I want talk therapy, but they trust the aspect that the fact that I'm a dance movement therapist, that I'm going to be more like body kind of positive, focus. I'm not going to, shut anything down or anything that that person may have experienced from other people. Who knows? So I have some people that reach out to me a lot for that as well, and I can help them build up their self-esteem and their body, and get comfortable in that, and they have that body positive view for themselves.
Oh, that's so cool. So when you are doing dance movement therapy, I mean, I think I know the answer to this, but it's not like you're going to say, all right, we're going to process your grief now. So these are the movements that you do to process your grief. Like it's not necessarily like a structured sort of thing.
Nope.
It's going to be super, I'm assuming it's going to be super like client-led, client-directed, kind of like up to their, like whatever movements feel comfortable for them.
Definitely. It's going to be based on movements that feel comfortable for them, and the therapist can help to challenge them to push them further. Also, I do treatment plans with my clients, like with dance movement therapy. I'm like, what are you wanting to focus on? Like, are you wanting to focus on grief? Are you wanting to focus on trauma? Are you wanting to focus on anxiety? Are you wanting to focus on depression? Okay, let's set goals. Let's set priorities. And then we kind of work in that aspect of what their first priority is. And it's kind of like, okay, so if somebody came to me for trauma, essentially, like I'm going to input a little bit of art into this as well. So I'll have them draw something out, and then I'm going to be like, okay, now let's move with this. Like, what is drawing? How does this move you? And get them kind of comfortable in the aspect of having kind of that creativity flow happening, and like getting the idea reeling in their head. What does this look like? What does this feel like? And so it's their story. It's kind of like we're having them tell the narrative of their story through their movement and kind of what that trauma felt like to them, maybe what they actually experienced. I will have some clients that have suffered from DV, that have been choked or held, where they've been bruised so much, and they will literally show like that type of movement. And so I know the areas of the bodies where they have suffered some of that, and I know the areas that we can work on through that. And so it's kind of like, okay, I see these things, I'm noticing these things, I'm observing, I'm assessing at the same time, and helping them in the moment. So it's very interesting. It's client-led. It can also be structured a little if they feel comfortable more with structure. I have conversations with them about that, because I'm like, this is your body, this is your movement. How your body moves is different from how mine moves. And so what does this look like for you, for wanting structure?
And I would imagine it's different than like, I mean, obviously this is so different than a dance class, but it's not like you're teaching them certain dance moves. It's more, I'm assuming it's more of like you are, you know, working to show how that your body processed it, or what does that movement look like for you, or some of those sorts of questions.
Yes.
No, this is so cool.
Yeah. And I'll bring in prompts too. So if I notice that somebody's struggling,
yeah.
if I'm just putting them on the spot, you know, kind of how like we ask the question to put a client on the spot and they're kind of like, oh, you stumped me. It's kind of like, okay, now what does this look like? And I stump them. I'm like, okay. I'm like, let's take a breath. And I'll bring out like a bunch of prompts and I'm like, what do you gravitate towards in terms of being able to help you through this? And a lot of them go for my dancing scarves,
of course,
which is kind of like this little like see-through kind of like colored fabric. And it just helps them to be able to have something tactily in their hands that can express maybe what it is that they're feeling. And they get to choose the color that the emotion resonates with. So like I'll see people like pick for anxiety orange or yellow. It's like kind of interesting to see those connections, and having them work through with the prop. How does this feel for you? And as they work with the prop, I'm like, okay, now let's see how we can incorporate that somewhere in our body. Where does this feel in the body? Okay, all right, this is where it's feeling in the body. This is the movement that happens with that body. And so that they feel comfortable with that transition period.
No, this is awesome. And this is like a side note too, but a couple of weeks ago, we came out with an episode all about self-care, and we had a therapist on who, shout out Taylor, she was talking about how when she gets done with work every day, like one of the best ways that she likes to process what happened at work, or like kind of get her like stress or anxiety out, is to dance. Like she goes home and dances. And I was so inspired by that, because I was like, man, dance is such a good way to kind of get some of those feelings out, move your bodies, especially for us therapists who like spend a lot of time sitting all day. And then even just to feel silly or feel like we're getting, I don't know, just some of that stress out. I think it can be so helpful. I'm curious, what is the role of music in this? Do you choose music? Do the clients choose their own music? Like I'm curious about how the music works.
It's different for all ages. If it's a child that's coming to me when they're doing dance movement therapy, and obviously music is a huge factor when it comes into dance, right? Like how the music is, sometimes even though we might be focused on like, let's say grief, if the music is really upbeat, the client's going to end up gearing off toward that upbeat music and not be focused on kind of what the thing is. And it's up to the therapist to go, okay, did we process enough of this and they need that change? Or do we need to refocus them back into this and change the music? So I have a bunch of dance movement therapy playlists. Some people get overwhelmed with having to pick music. So I will just kind of have different kinds of playlists in there. So like I have one for just kind of like if a client needed more grounding on that day, like I have more like kind of mellow meditation type of music to help with the grounding. If somebody's really in like really intense emotions, I have music that has the intensity, but then it has some mix in there to help with some grounding in there as well. So I have playlists. If clients come up to me and they're like, hey, I have this song or I have this playlist, like, yes, they can come to me with that. And I will absolutely 100%, support them in that. I always just kind of say like, that what we have our little white noise machines. But I always am like, we have to be mindful of other therapists and clients that are here.
I didn't even think about that. That's true.
Yeah.
Interesting.
In the offices. So I'm just kind of like, make sure it's not like explicit, like if there are curse words, they're like bleeped out, those things, because we have people here of all ages. And, I get some people are like, the rap music identifies with them. And, this type of music identifies with them. I'm like, let's just be mindful. Like, let's find the clean versions of things. So that way we can keep the therapeutic environment going. But then the client is still getting that kind of feeling of being validated through the music with the movement.
Yeah. Yeah. So, okay, then like, are they putting together like a choreographed thing, or are they like doing like, okay, this is my song that I'm going to choose and I'm going to process my grief with this song and I'm going to, put together like not a show, but like put together a dance for this song? Or is it more free flowing where it's like, today I'm dancing to this song, next week I'm going to dance to a different song sort of thing?
It can be either way. It's interesting. There's so much creativity that can happen within the dance movement therapy world. I will ask clients, do you want this to be kind of like free flowing, where it's different each week, or are you wanting to have something that is choreographed and special? Kind of like similar to what I did. Like my video that I did, it was choreographed. There was no, but I was also dancing too. Like I was a dancer. So it was very choreographed for me. And if the client's expressing that they want that to be choreographed, I will honor their wishes 100%. And I will help them through that process, because that is not an easy process in and of itself. Just taking the therapy aspect out of it and putting the therapy aspect back in, that can be really challenging, which is where the therapist comes into play to help that client in those moments of when they're feeling over a month's amount of emotion. Okay, like let's pause. Like we don't have to choreograph right now. Like let's process this. Let's just not think about the choreography and let's just talk. Let's maybe ground. What do you need? But if they want to choreograph, I will honor those wishes. If they just want it to be free flow, I will honor those wishes. There is no like set thing that they have to do. It's what they feel comfortable with.
This is great. So I'm assuming that you are like up dancing with them. It's not that you are just like sitting in your chair being like, go ahead. Or like, how does that work?
So most of the time I'm moving with them, unless they tell me otherwise. I'm moving with them so that I don't feel alone in the process. They don't feel weird. It doesn't feel like, I'm the dancer and you're the teacher and like, are you critiquing me? I'm able to move and observe at the same time. Also, there's this beautiful, lovely technique that's out there that's just called a mirroring technique that helps with the client feeling validated, helping them with feeling kind of that sympathetic, that empathetic, that nourishment that they sometimes are lacking in those moments. And the mirroring technique really helps with that kind of portion. So it's like I will have them do that and I will mirror exactly what it is that they are doing. Just kind of like nice and easy into it of whatever they feel comfortable like with. And it's kind of like, hey, like I'm done. Like we gotta close that out. And I'm kind of like, okay, how did that feel for you? What did you notice? Especially like with a trauma story, if they're doing that and mirroring, it can be really liberating for them to finally have that person to come through and be like, I am mirroring your movement. I understand what it is that you are feeling. I hear your narrative. And I'm validating your feelings in this. And moving through that process with them. I actually did my dance movement therapy thesis on trauma and how to apply all of these techniques for different trauma situations. So it's very interesting in how to take some of the dance movement therapy techniques to help a person with their narrative and rewriting their narrative through movement. It's very intriguing.
Okay, mirroring is such a cool concept. I can see how helpful that would be for people. Are there like what are other techniques that you often will use with clients that are kind of similar in that way?
Things that I definitely my 100% like go-tos for my clients is what I call as a body map. And this body map can be whatever they want it to be, but it helps them and helps me to see what's happening in their body. I don't typically do this on the first or second session. I typically wait a little bit till they get a little bit more rapport build, and I will have them do a body map. And the body map can be done two different ways of whatever the client's comfortability is, of actually either tracing out their body on like the big, huge like poster board stuff. Or I just print out a little outline of a human body on just a little piece of paper. And I have them list out emotions that they feel in certain areas. Or this can be like things that can trigger emotions. So like words, music, things like that. and have them kind of labeling out those things in their body when they feel certain things. So it gives me an idea of when I'm working with them, kind of if I'm noticing like maybe their hands starting to get super shaky, I'm like, okay, we talked about this. We did our body map. This is a trigger. You're feeling super anxious right now. I need to stop and we need to ground. Or it's kind of like it's something in the stomach. A lot of times like I'll notice I'll put something in the stomach and I notice that they're not sitting upright or proper anymore. And like they start to cower in because they're trying to like comfort their stomach. And so like these are the things that I notice, these are the things I observe. So that's why a body map is important to me. So that way I can continue that observation. And I always do it again at the end with them when they discharge. So that way they can see if anything has changed, what's different. And we can talk about that on their discharge and be like, this is how dance movement therapy helps you. And that they have that visual aspect too. So that's one of my
that's
go-tos.
such a cool tool. Yeah. And I mean, I often have Gina on the podcast. She was my clinical supervisor and she does EMDR and mostly works with kids. And she talks about a body map a lot too, and just kind of helping kids, identify different feelings and where they might feel them in their bodies, and just to try to help them kind of connect that body, the body and mind, like as you're noticing these different emotions. But okay, so I love that you do that in dance movement therapy too. Do you mostly work with kids or do you work with adults? Like what ages do you typically see?
It's all ages. Dance movement therapy has no restriction. We can adapt to anybody's needs. So if I had geriatrics or elderly coming in, and they want dance movement therapy, I'm gonna fit for their needs. Like I have young women come in. If it's boys, it's more or less on the younger side, just because as they get older, it's kind of like seems like the stigma of like doing something artistic like that. But sometimes there will be a couple that come in, kind of trying to destigmatize those things in the society world can be a little hard. So as it kind of gets up in age, I do kind of see it tends to be more women, but as it's kind of like 18 and under, it can be female, male, whoever it comes in. There's no restriction at all. There's no restriction for mental health diagnoses. There's no restriction for age. There's no restriction for ability or no ability. It's so adaptable. It's like
that's so important and so cool, because I can see how like some people might wonder if like, oh, can I do this, or is this going to work for me because I have mobility restrictions or different things like that. So that's cool to hear that like it's just super adaptable. Gosh, I'm trying to think of what other questions I have. So you personally, as a dance movement therapist, like, do you have certain diagnoses or like certain presenting issues that you like that are kind of your niche or that you prefer to work with?
I'm very open. I do tend to see a lot of people that come in for dance movement therapy to be kind of trauma, sexual assault, like we're looking at physical assault, we're looking at childhood trauma, like any types of those traumas that can kind of come into play. That I mean, everybody hears the famous book, The Body Keeps Score, but like literally like your body's keeping score. So like if you have trauma from your childhood and it's still like you feel like you've cognitively processed it, and like this is where I kind of like notice this happen a lot, is they're kind of like, I feel like I cognitively have processed this. Like I've done trauma therapy and stuff like that, but they didn't get that mind-body connection, and they're feeling like they have lingering effects in their body. And so they'll come to me and we'll process like their trauma through their body. I have people come from grief when they're kind of like, I feel like when grief hits, like you just get like a month's amount of just weight. Like you just literally feel like you're being pulled down to earth center, and you're kind of like you cannot walk. And so like learning how to be able to begin to let go of some of those chains and process that. I have a lot of people that will come for anxiety. They're like, I want to understand how to manage the anxiety in my body, because they notice that the anxiety in their body comes before the thought process. And so they're like, if I can regulate it in my body, then the cognitive won't be as bad. I have a lot of people come to me for those things. This can also be something
Fascinating.
that can be helpful for autism, ADHD, any of the
Mm,
neurodevelopmental disorders as well.
yeah.
Um, and those are kind of like the things that I've noticed and seen.
Mhm.
Now, I did work in a facility where I had a variety of diagnoses, and it kind of is just how the person's open to it. Are they open to dance movement therapy? Are they closed off dance movement therapy? And if they
Mhm.
are, why?
Mm.
Are they afraid something's gonna come up? Is it just not their thing? Which is okay, right? If it's
Mhm.
not your thing, that's cool. Um, so it's interesting to see the different aspects that have come into play when I was working in a facility
Oh,
of
yeah.
how dance movement therapy works with different diagnoses.
Sure.
And so I would have some people be like, hey, are you doing individual dance movement therapy sessions? And I'm like, very small throughout my week, but yes. But I always did like a dance movement therapy group with them.
Oh,
And
cool.
so we would all be able to kind of have like a topic of some sort and
I
work through
love
it.
that. Okay, dance movement group is such a cool idea. I didn't even think about this. So then, do you choose the music and the topic per week, or how does that work?
I will always choose the music
Okay.
because if you get a lot of people in a group
Yeah.
and you're kind of like,
Yeah.
who wants what music? It's
Right.
really hard to like regulate that. So I
Mhm.
will always choose the music, and that's where my playlists come into play.
Yeah.
If having a variety of them, I will ask them topics. So boundaries is like a big, huge one that
Mm.
a lot of them will come up. Is like learning like the physical boundaries that you have, and
Mm.
also gaining their strength of like how to say no
Mhm.
for certain things. A huge topic that comes up for everybody though is anxiety management and stress management, depression, management of depression. Sometimes we'll get super specific, and in those moments I try to be super mindful because it's not going to fit everybody's needs.
Sure.
When it comes to a dance movement therapy group, I try very hard to keep it very generic and open
Yeah.
so that way everybody can relate in some
Mhm.
way, shape, or form. And it doesn't feel like they're kind of like the outcast. And kind of
Mhm.
like, well, I didn't get anything from this group, kind of way.
When
So
you choose
that's,
music Oh, sorry, go ahead.
no, you're good. So that's to say that's kind of how I approach like the aspect of forming my groups for dance movement
Yes.
therapy.
When you choose music for the group, does it usually have lyrics, or is it like instrumental?
Both.
Okay.
So if I'm looking, I'll sometimes ask them like, "Do you want lyrics or do you want instrumental?" And kind
Mhm.
of at that point, it's kind of like I let them know like majority vote, and like you're gonna be able to get through the group no matter what. um, so just breathe, but it'll be
Mhm.
majority vote. But there's other times where I'm like, I'll just kind of pick the music. Like I'll maybe have the music on before they come in,
Mhm.
and
Oh, sure.
giving them that type of environment. Everybody's different. There's some dance movement therapists that are like, I'll ask. There's some dance movement therapists that are like, hey, I'm always going to have the music playing on before. I switch it up. I
Mhm.
personally, when I give them that ability to have any kind of client direct led thing for like in a group with like that opportunity chance to snag it, like I see their like eyes light up and be like, oh, I get to participate in this kind of way,
Uh-huh.
which
Yeah.
is fun. So that's kind of my way of doing things.
Mhm.
Again, I always make sure my lyrics are clean if there is anything that gets up into that area. But um, there are lyrics. People resonate with lyrics. People resonate with certain
Mhm.
verses or chorus, and being able to have that ability and not everything just instrumental, like it adds that extra layer of being able to process and
Mhm.
recognize something that's a mind body connection and like, oh, yeah, I didn't recognize that, but now I do.
Mhm.
Um, it can't be just one way. And like, at least in my mind, it can't just be one way. Everybody has their different viewpoints, but for me,
Sure.
you got to have it open
Yeah.
for
Yeah.
everybody to work through what they need to work through.
Right. So, for a therapist who's listening to this who might be like, I didn't go to school for dance movement therapy, but I'm thinking of a client that would probably really benefit from, like doing some dancing in sessions. How would you recommend a therapist kind of start? Like, would maybe this is a good opportunity for grounding, or maybe it's a good opportunity to just kind of like get some of that anxiety or do some of this work. And what recommendations would you have for a therapist who maybe is just wanting to like dip their toes into it a little bit and help their clients?
Yeah, absolutely. Grounding was the easiest one personally for me. When I was even just starting to like begin to dip my toes in it in the dance movement therapy world, it was the easier one for me to like grasp onto, in terms of bringing those concepts in. Um, there are so many ways that you can help someone ground, right? That is doing through movement that is small or big. And in the dance movement therapy world, breath is a huge thing. We want to make sure we're breathing while we're moving, but also if you notice that somebody's beginning to hyperventilate, like taking that moment to be there with them. I add an extra layer for the breath. I don't just be like, okay, and like listen to my voice and breathe in and breathe out. Like I want them to feel their breath. So I'll have them kind of put their hands where they're comfortable. If they're a stomach breather, they more feel the rising in their stomach. I'll have them place their hands on their stomach. If they are not a stomach breather and they breathe more through their ribs, I'll have them put their hands on the sides of their ribs or on the front and the back. So that way they can feel the breath happening. Tapping is a great one, right? Is not hugely known out there, but like the tapping, guiding them through the tapping on the wrist, on the temples, on the center, anywhere that's kind of like getting them to like get the body to signal out like, hey, it's okay. Like this is a new sensation that's happening. Let's focus on this and let's get grounded. We use progressive muscle relaxation. Tension release. It's a huge thing. When you get anxious, you get into a stress response. And oftentimes what happens in your stress response, no matter which one you're in, your body tenses up. And you just have this kind of like, and like the feeling of just tension. A lot of people get in their shoulders or their neck. And it's kind of like, oh, okay, you're realizing more tension there. So taking that moment to like kind of lead them through some like very minor, gentle stretching for those areas. Progressive muscle relaxation is super helpful for those areas. There's a technique that I use a lot with my clients that for grounding purposes where I have them begin to visualize like whatever their safe place or peaceful place is. And I have them, like, I walk them through the path and I have them get there. And when they're there, I have them take a couple breaths and then I will have them start to do movement visually in their mind and begin to do that movement in their body at the same time. And that way they're there in their mind, but also in the present moment, their body's actually moving with them. And so like a lot of times, like it'll be a lot of like arm focus, especially if you have them sitting down, it'll be kind of like a lot of arms. You see like it's just kind of a lot of like flowy arms happening because they're regulating themselves. They're in their peaceful place. So it's really nice to see. And then what I'll do is I'll be like, okay, and we're going to, if you notice that one way is like, we're going to bring your hands together and you're just going to take a nice deep breath in and like let them circle out and let them come back into reality moment. And I'll talk with them. I'm like, how was it to be in the present moment and ground yourself at the same time? And they're like, whoa, what was that experience? And so those little things can be super helpful. Starting to dip your toes in those things, super helpful. If it's children, I will literally do patty cake with them. Get their minds off into something different, something that's fun, something that's uplifting. Just kind of having them even like just twist their bodies up, like anything. I found this like coping and grounding skills sheet that has like a bunch of like weird body things that you can do. And I'll sometimes implement that into a session and have a client do it. So get creative. Utilize what's there already and exploring that creativity of what does this feel like? And I always say, for me personally, what I do as a dance movement therapist is if I'm trying something new, I try it on myself before I try it on a client. So like if I saw a client and I'm like, oh, I have this idea for grounding technique, but I don't know how well it's going to work. Like I will legitimately practice that on myself.
I love that. Yeah.
and then I'll do it on them. So I have the comfortability in that.
Mm-hmm.
You can always practice things on yourself to see how that feels and then implement it into a session.
Yeah. Yeah. Okay, you have given so much good advice. Like, this has been such an awesome episode. I really appreciate you coming on and just sharing your own personal connection, and also just like really, really good tips and how people can learn more about this and how they can even implement this into their sessions with clients. Any other last thoughts or things that you feel like we're missing about dance movement therapy?
It's an ever-changing world. If therapy is ever changing, therapy for dance is ever changing. Constant research is happening. It's a field that's been around for a very long time that scientists for a long time didn't believe was evidence-based. And now they're seeing the evidence base. And there are more and more dance movement therapists out there now that are doing research and actually applying these psychotherapy techniques to the dance movement therapy
So
sessions.
cool.
So that way it can actually be like billed for insurances and the clients can get extra benefit out of it. So
Mm-hmm.
I know there are a couple of dance movement therapists out there that are currently like working on like cognitive behavioral techniques for dance movement therapy and
Awesome. Wow.
dialect behavioral therapy techniques for dance movement
Mm-hmm.
therapy. It's interesting to see the research. Trauma has always been a big one for dance movement
Mm-hmm.
therapy, but to see that they're starting to bring these types of things in, I'm like, ooh, what does this do now for us to continue to grow?
Yeah. Yeah. I love that. Well, thank you so much again for joining, Shelby. This has been such an awesome episode. Yeah, I just really appreciate you coming on. And thank you so much to everyone who's listening. And I hope that this has been helpful. We'll see you next week.